Hi, it's Dr. Rajesh Khanna, known as the Laser Man, bringing to you the latest technology in refractive surgery. Around 15 years ago, we were proud to bring in the form of a book called Prelex, which we updated by a new edition called Rejuvenate Aging Eyes During COVID, which talked about presbyopic implants, which was a great solution for people above 45. And it surpasses LASIK. Now for under 45, we have a technology which surpasses LASIK eye surgery, increasing the safety and recovery period. It's called SMILE. So we'll discuss what is SMILE. It's an acronym for Small Incision Lenticular Extraction. Don't panic. We'll explain everything. We'll say how it was developed, how it's overtaken LASIK, and where does it go in the future, and what you can expect it if you're a good candidate and how to find that out, and any side effects. Before going into the nuances and advantages of the new surgery, I want to tell you how do we see. You see, all the light we see here or any object we see, the original light comes from the sun, and as it travels through the atmosphere or bounces off object, it changes its wavelength. So basically it has some information stored in it in the form of the wavelength and frequency, which we are able to know what the object looks like. Now this information has to reach our brain, where it can be re-engineered into actual 3D images. So the light is coming from the sun, gets reflected on, let's say, my hand, and then it reaches the eye. Now it's very important that the light focuses exactly on the center part of the retina, which is the last part, and it's called the macula. Because here the nerve endings are maximum, so to convert the light energy which came in into electric energy so it can reach the brain through the optic nerve pathway. What that means is the light which is coming has to get focused onto a single area and not in multiple, not in front, not in behind. Therefore, the length of the eye and the converging power have to have a very good relationship. The converging power, just like a magnifying glass, is provided by the cornea, which is the clear part of the eye right in the front, and the natural lens. The two combined together converge the lens. But now if there is a mismatch between the length of the eye and converging power of the eye, we get errors of refraction. If the converging power is too strong or the eye is too long, the image will not be formed because the light will get condensed in front of the retina. And so there will be a blur. And the reverse, if the eyeball is too short or converging power is too weak, the light will not converge till it's reached the retina and we'll get a virtual image. And astigmatism is if one part of the light falls in front, one on the retina, or some on the retina, some behind, or some in front and some behind. Too much, right? But just to know, we need to get the light on the retina. And traditionally using glasses, like if it's too strong a convergence, then we use a divergent lens. And if it is too weak, we add a convergent lens. So when the convergence is less, when the image is formed behind, that's called farsightedness or hypermetropia. In such a case, we have to add a convex positive lens to increase the converging power. In nearsightedness or myopia, since it's getting brought to a focus in front of the retina, we have to add a divergent or minus lens. Pretty simple, and same things are working in the contact lenses. And when we have been doing LASIK, we've been doing similar idea about increasing the power in farsightedness by curving the cornea, or decreasing the curvature by flattening the cornea by removing central tissue in myopia or nearsightedness. So now we will go into the history of refractive surgery to see who developed SMILE and where it is in the timeline of history for refractive surgery. Now, refractive surgery is not new. People invented glasses 200 years ago maybe, but pretty soon they realize they want to get rid of it. So right from 1940s, refractive surgery has been tried. Some people tried to change the length of the eye. Others wanted to change the shape of the cornea by freezing cornea and curving it on a lathe and then stitching it back. But all those, as you can see, did not work or were too cumbersome to make it happen. So the first major leap was out of Russia. Fyodorov very invented radial keratotomy, or cutting the cornea in vertical incisions so it could change the shape and the power of the cornea. It was brought to United States, and then within a few years it was realized it does not give very exact results, and the results are not stable over time. At that time, laser was being developed, and then it was applied to the cornea, first initially in non-sighted eyes, and that was the birth of PRK. Another technology developed at that time was automated lamellar keratoplasty. Please listen to this because this is very important to understand how SMILE came into being and works. In automated lamellar keratoplasty, we had a microkeratome which made a flap in the cornea, and the same microkeratome used a different setting of the blade to make a deeper pass, and that intervening tissue was removed. How much tissue was removed depended on the nearsightedness the person had. As you can see, it was not as accurate as people would have liked. So this morphed into Lasik as PRK merged with this. We made a flap, and instead of applying the second pass, we used excimer laser. Now, same ALK gave rise to SMILE because the second pass, instead of being done by a microkeratome, could be done very accurately with a femtosecond laser. So we could precisely control -3 treatment versus -3¼ versus -3.5, which was difficult to do in automated lamellar keratoplasty. So it was not a big deal because, hey, you were doing LASIK, and now you had the flap made initially by microkeratome and then later by lasers, and then you're applying excimer laser. And then in precursor to SMILE, which was called RELEX, or refractive lenticular extraction, you were lifting a flap and then using again a femtosecond laser to carve out a disc. So it didn't really get much traction till the RELEX morphed into SMILE, or small incision lenticular extraction. The difference being, in RELEX you had to make a flap, but if you did make a flap and made only a small opening and could take out the disc through micro instruments, hey, you had quicker recovery, increased safety. So you could play contact sports, you can jump into the water sooner. So this was the birth of SMILE and a much more advanced surgery. Now, any new surgery, including LASIK, had taken many years to reach where it becomes good and attractive as the benefits outweigh the risks and the nomograms get perfected, so the outcomes are very precise. And that's what happened between 2011 to 2017, where it was being researched and used abroad and in FDA studies when FDA approved it. And then, after FDA approval, there's always a post-market process, which we observed between 2017 to 2021, where the nomograms became tighter, the outcomes better, the software upgraded. And now, since one we have been doing from 2021, the outcomes have been 2020 day 1 or day 2, and nearly 100% success rate with almost 0% enhancement rate. So that increases the safety, the faster recovery, decrease enhancement rates, and as technologies are advancing, it's going to become the procedure of choice as the older technology which people have acquired and been using and learn the new skills. Smile will be the destination for your eye surgery today, tomorrow, and forever, till we come up with something better, maybe in 30, 40 years. So now next we'll talk about who is a good candidate for smile.
Yo, I'm the OG, been around for years. Clearing up vision, been drying those tears. I'm sharp with the flap, cut it right, no delay. Fast recovery, 2020, I slay all day. Laser beam strong, my results are on point. I change the world's view, you know, I anoint. Smile, you fresh, but I paved the lane. Been stacking up wins while you're just in the game. I've been a kingpin, vision correction king, 2 decades deep. See how I bling with a flap, I make moves, sharp and slick. Smile, you're cute, but you just a little trick. But who's got the stats? I've helped millions see top docs in the world, they all still back me. I'm quick, I'm trusted, I'm proven and fast. If tech's still new, you won't last. Don't forget my speed, I get the job done. Most folks recover in just day one. I slice through the fog, bringing clarity fast. Smile, you're still running, trying to catch my blast. Listen, young duck, you still got some flaws. High prescription, astigmatism, give me applause. I tackle it all, make the whole world see why you've got limits, trying to catch up to me. Yeah, you fancy, but docs know my name. I've been the gold standard, I rule the game. You making noise, but it's just a trend. In a few more years, your hype will end. You think you're smooth, but I see your cracks. Not everyone can get smile, that's just facts. I work for many.
So now let's look at smile versus LASIK, because you know LASIK has been the old champion, and we have a very fun-filled diatribe between Kendrick Lamar and Drake-based sounds. We're talking about the smile versus LASIK, and you got to hear that. But in short, LASIK has the advantage that it's been longer, with a longer track record, and it has been able to be used precisely, and the approval is more. Like, it can treat up to 5 diopters of astigmatism. It can treat hyperopia. So if you're in those categories, yes, LASIK. But for all others, which will be the majority of the people, the advantage of smile is smaller opening. In LASIK, the opening is like the flap, 18 to 20 millimeters. You lift it up. So when you lift a flap, what all can happen is things from the atmosphere can electrostatically get in. And that's why we have to wash in the end, which creates some edema or fluid in the interface. Also, anything can seep in, whether it be foreign bodies at the time of surgery. Sometimes blood cells can seep in, epithelium cells, and that's why we had epithelium ingrowth problems. Later on also, epithelium can grow in if there is a gap, especially if you lift the flap up and don't oppose it properly. And the worst case that can happen is, because there's such a big opening, some bugs can go in. Let's say all that is still good. Then if you're into contact sports, there's always a theoretical possibility, which we've seen in the past become reality. The flap can get dislodged if somebody hits you in football, or while surfing the wave hits you at an angle. So the recovery is also takes time, because the flap has to stick. So we say wait 3 weeks before going swimming or into spa. And contact sports always remain a little dangerous. In smile, since the opening is less, you can be back into swimming or surfing in 3 days instead of 3 weeks. And since there's no flap, nothing can get dislodged. And since the opening is only 2 to 4 millimeters, the amount of things that can enter are statistically insignificant, or 1,000 times less than what can happen in LASIK. So it increases the safety. Now, what about the outcomes? As I was telling in the previous chapter, from 2011 to 2017, the outcomes improved exponentially. And since then, they've been fine-tuned to make it even better. And in the next generation of smile, which has got FDA approved, we can lock the eye using IOL master, so the astigmatism can be corrected more finely, and if the eye moves, it can move. And the whole procedure has duration has become so short, it takes a few seconds and is now become much faster than LASIK. So overall, Smile is safer than LASIK clinically, but even in lab they have studied and seen post Smile corneas are stronger than post LASIK cornea when same treatment is done in both. And the reason for this is in Smile we remove tissue from deeper part of the cornea, which gives less tensile strength to the cornea. So even though you might remove 5-10 microns more, it affects less, as the Bowman's membrane and the superficial area are the main strength giving, which get transacted in the LASIK flap. That also brings us to dryness, because most of the nerves are in the top of the cornea where LASIK works, whereas in Smile in the deeper part they're less corneal nerves. So when we traumatize the nerves less, there's going to be less dry eyes. So for all these reasons, increased tensile strength, less dry eyes, quicker recovery, safer outcome, and less chances of enhancement, Smile is the better option for nearsighted people with astigmatism up to 3 diopters. Thank you.
It's time. Time to set your eyes free. Free from limitations in your vision. Free from glasses and contacts. Free to see your best and be your best. It's time to smile. Smile is state-of-the-art laser vision correction, or LVC for short. Maybe you're new to LVC, or maybe you've looked into it before. Either way, it's time to take a closer look at Smile. Smile has revolutionized LVC, with more than 2.5 million procedures performed worldwide. So what's new, different, better about Smile? Compared to other LVC procedures, Smile is minimally invasive. Using a precision laser, the surgeon creates a thin lenticular disc and a small opening, just 4 millimeters, 80% smaller than other LVC procedures. The lenticule is removed through the opening, and unlike previous generation LVC, Smile doesn't involve cutting a flap on the eye's corneal tissue. In short, Smile is easy on the eyes. It's bladeless, flapless, and effortless. The simple one-step procedure takes just minutes to perform. Patients report little to no pain or discomfort. Best of all, recovery time is fast, with most patients back to work and back to play in one day. Because your life won't wait. It's time to say goodbye to glasses and contacts, goodbye to the inconvenience, and goodbye to the expense. Smile is actually less expensive than buying contacts or glasses over time. So it's an investment in your eyes in more ways than one. And if you have to say goodbye to your contacts even though you like them but your eyes don't, say hello to Smile and hello world. Discover the bladeless, flapless, effortless LVC and the smarter choice for better vision. Look into Smile. You'll love what you see.
Now that you've decided to have Smile eye surgery, and in the consultation you've been proven to be a very good candidate, we bring you to the preoperative exam, where not only the safety measurements which we had done, but we will be doing more advanced measurements and numbers check to make sure everything is stable, and that's where we calculate both what prescription to treat and what algorithm to apply to make modifications based on age, prescription, and our laser. So each laser is unique, just like your eye, and the nomograms are built around each laser and they're fine-tuned. We will also make sure that the rest of your eye, that there's no macular degeneration, no glaucoma, no advanced dryness, and if anything we find, then we discuss with you. And if dryness is there, which is very relevant and common in Southern California and hot areas like that, we start dry eye treatment. Of course, there's consents where we'll discuss everything in detail, so you don't have to Google anything or talk to your cousin's uncle somewhere. And both the advantages, disadvantages specific to your eye will be especially discussed. The financial considerations will be taken care of, whether you want to do low monthly installments through Alpheon or you want to write a check. All that our staff will help you with. And then we will give you instructions for the surgery. Basically, they are pretty simple. On the day of surgery, don't apply makeup, don't apply strong cologne or perfume which can interfere with the laser functioning. You can eat a light breakfast or lunch and come. Have somebody bring you or come by Uber so you don't have to drive after the surgery, especially as we might want to give you Xanax to relax if so you want. And so in the next part, now we're going to the actual surgical part. My friends, the day of surgery has finally arrived. I know you're a little nervous, so when you come, we'll greet you warmly and give you a little Xanax. But prior to that, we'll confirm that you don't have any questions, and we will double check the numbers, prescriptions, anything we need to do. So it's better to check 10 times and operate once, as an old dictum, you know. And you'll be free to use the restroom. And once all that preliminary things are done and you feel comfortable, we'll be cleaning your eyes with betadine, which is a very strong antiseptic and kills all the bugs. And you would have started your antibiotic drops. If not, we will start that then. We will also give you a cap to cover your hair. And then you're ready to move into the laser suite, which will be cold compared to the outside temperature because these lasers are very finely kept in a very small range of temperature, like around between 68 to 70 degrees. And the humidity is controlled, as is the air inside. You lie down on the comfortable bed and rotate it under the laser. And we'll be centering the body and the eye using special equipment to make sure your head hasn't tilted or rotated. And there are LED lights which we use to make sure everything is perpendicular to marks. Once you're comfortable, you'll be brought under the laser where you'll see a blinking line, and this is known as the alignment. And there's a patient interface which will attach to the laser and calibrate. So before every eye, we are calibrating again. As the bed is raised or the laser comes to you, the blinking white lights will become more clear and you'll be looking at there. And we'll be aligning to your line of sight, which is usually at the center of the pupil. But in some people, like high myopes or high hyperopes, it can be a little different. So let's say we're talking smile, so high myopes. Then we can adjust a little bit to fudge between the two. Don't get the wrong word fudge, but we are using measurements to see where the center of the pupil is, where this line of sight is, and make adjustment so that not, because we have to treat that the line of sight because that's where you see from, but also since we are making a disc, we want to make sure it is not too off center. Little technology and skill thing. But anyway, now that we've centered, then the interface will come towards the cornea, or cornea will come to the interface. And once the opposition is there 80%, we'll apply the suction. You don't feel it, it's painless. And in the next few seconds, which can vary from 16 to 23 seconds, the disc will be created. First, there'll be the lower or posterior surface will be made, then the anterior or superior surface, and finally the cap. Once this is done, laser is taken out and microscope brought on. And when microscope is there, then we will apply Q-tip with anesthetic to numb the area which we are going to hold. So when we hold there, then we can make opening in the incision and find the anterior plane or superior plane of the disc and the plane behind. This is a very important step. Then we use a special olive tip smooth dissector without any sharp points to separate the anterior surface fully, and then the posterior surface and then we grab the disc and take it out, and voila, you're done. My friends, the surgery is done. We can all relax and heave a sigh of relief. Everything went beautifully. You will see, but it'll be blurry, foggy, like seeing underwater. No problem. After the surgery, we put some more drops in your eye, antibiotics, steroid and non-steroidal. Take you to a dark room, let you rest and relax, and all the tension wear off. Then before going, we'll do two things. We'll inspect your cornea to make sure nothing entered the interface, which is very rare, but also to make sure the opening is well opposed and there's no epithelial debridement or trauma there. Once that is done, one of the assistants will give the post-op instructions, which is mainly do not touch your eyes, wear goggles, tape to your eyes to sleep so you don't accidentally rub your eye, and then you put your drops 4 times a day. Artificial tears in between as needed, and set up an appointment to come and see. Very simple. So now what can you expect? You'll expect some foreign body sensation at that time. Vision is blurry, so you cannot drive. You need somebody to take you home. When you go home, take a nap. By few hours later, you'll get up, you'll see your vision has improved. Most of the people start driving, though we caution because you've had Xanax, avoid that. Next day, maybe 99% will be driving around and seeing and going back to work. One person might take 2 to 3 days more. Everybody is different. During that time, you'll be putting your drops as prescribed, artificial tears as we talked about, and wearing sunglasses outside so not to irritate your eyes. And then you do your post-op exam with your eye doctor, be it the surgeon, optometrist. Once they give the clearance, you're ready to snowboard, ski, or jump in the pool, or dive, or whatever. You still have to be a little careful because the eyes will be sensitive, but the things keep improving, and any side effects you might notice early on, like glare and halos in the nighttime driving, will go away. And during that time, don't look at the lights to see if there is glare or halo or it's going. Like if you see an ambulance, don't try to stare at the lights and all. Just let it be and look away or next to the light or above the tail.